6 basic positions are used when a person must remain in bed or seated for a long period of time. In the supine position, the person is simply lying on his back, the bed is flat, and the person's head is supported with a pillow. In Fowler's position is a variation of the supine position instead of being flat, however, the head of the bed is elevated between 45 to 60 degrees. In semi-Fowler's position, known as low Fowler's, is with the head of the bed is elevated between 30 and 45 degrees. This position is comfortable for a patient who is on aspiration precautions, receiving tube feedings, or experiencing reflux problems. In high Fowler's position is with the head of the bed is elevated 60 to 90 degrees. This position is useful during meals where it aids digestion and during grooming. Begin each interaction with patients by performing washing hands, introduce yourself, identify the patient, and explain the procedures. Prone position. The patient is lying face down, then turn the patient's head to the side with pillow for comfort. Also, to make breathing easier, another pillow is placed under the lower abdomen and pelvis, and another pillow is placed underneath the lower leg to keep the feet aligned and prevent the toes from pressing against the bed. In Sims position, it is used for patients receiving enema. It is used to relieve pressure on areas susceptible to pressure ulcers, such as the tailbone. In this position, the patient's head is turned to one side. The upper leg is bent sharply at the knee and supported by a pillow. The upper arm is bent at the elbow with the hand in front of the face palm down. The lower leg is straight and the lower arm extends from the side near the hips palm up. In proper sitting position, the patient's feet should rest flat on the floor. The knees are bent at approximately 90 degrees. The calves of the legs do not touch the chair, and the hips and back rest against the back of the chair. How to move a person up in a bed. In preparation for moving a person up in a bed, make sure the bed is positioned at a comfortable working height for good body mechanics. Then make sure the wheels are locked for safety. To begin the procedure, lower the side rails of the side of the bed. In this video, imagine that the side rails are lowered. Next, remove the patient's pillow and place it against the headboard of the bed. Fold the top linen to the foot of the bed. Ask the patient to bend her knees. And place your outside arm under the patient's head and shoulders, then lock your other arm with the patient's arm. Then ask the patient on the count of 3 to lift her buttocks while pressing her heels into the mattress as you lift her shoulders towards the head of the bed. There are some other methods of helping patients to move up in bed, such as with the assistance of a coworker. Grasp the edge of the lift sheet and roll it over as close to the patient's body, then grasp the rolled edge with both hands, then on the count of 3, slowly and carefully lift and move the patients towards the head of the bed. After that, straighten the linens and draw the top linens over the patient. Knock and identify the patient, introduce yourself and explain the procedure, then obtain permission. Open the wheelchair and position at the foot of the bed and place the gait belt in the wheelchair. Fold the top sheet down towards the foot of the bed, then explain to patient what is the next procedure. Ask the patient to scoot towards the edge of the bed, close to you, and ask to cross her arms over her chest. Put one arm under her shoulders and one hand over her right knee, then pull her knee towards you when you swing her shoulders up and until the patient is sitting the bed with her feet flat on the floor, and make sure the patient is not feeling weak or dizzy. Place the gait belt around the patient's waist and fasten it appropriately, making sure it fits correctly. Block the patient's feet with your foot and have the patient place their hands on your shoulders, then grasp the gait belt and assist the patient into the wheelchair. Remove the gait belt and ensure the patient is seated properly in the wheelchair with feet squarely on the footrest, and make sure the wheels are locked. Perform hand hygiene and ensure the privacy of the patient, then introduce yourself, identify the patient using 2 identifiers, and take the pulse of the patient, and make sure to ask if the patient is allergic to any lotion. Help your patient find a comfortable position, either prone or her side. Untie the patient's gown and drape the patient with folded sheet. Warm the lotion in your hands, then perform effleurage as a technique in which gliding stroke is used to massage upward and outward from the vertebral column and back again. This technique smooths and extends muscles, increases nutrient absorption, and improves circulation. Next, perform petrissage, a muscle kneading stroke that relaxes tense muscles and stimulates local circulation. Next, perform friction, a strong circular stroke that brings blood to the skin surface, increases local circulation, and loosens tight muscle groups. And encourage the patient to take a deep breath and relax. Patient that you are done and wipe off the lotion with a bath towel and tie the patient's gown. Then turn over the patient and evaluate the patient's pain level and provide any additional comfort. Perform hand hygiene and ensure the privacy of the patient. Then introduce yourself, identify the patient using 2 identifiers, and explain the procedure. Drape a bath blanket over the patient and ask her to hold the top edge of it as you remove the top sheet beneath it. Then place the soiled sheet in the linen bag. Fill the water basin 2/3 full of warm water and have the patient test the temperature of the water to make sure she can tolerate it. Then remove the patient pillow and place one towel under the patient's head and another over her chest. Begin the bath by immersing the cloth in the basin, wring it out thoroughly, then fold the washcloth to form a mitt. And wash the patient's eye with plain water from the inner to outer canthus and using a new section of the cloth in each eye, then dry gently. Next, wash, rinse, and dry the patient's forehead, cheeks, nose, neck, and ears. Then remove the bath blanket and place it lengthwise beneath the patient's arm. Washcloth in the basin, wring it out thoroughly, then fold the washcloth to form a mitt. Begin the bath by immersing the cloth in the basin, wring it out thoroughly, then fold the washcloth to form a mitt. Next, wash the hands and nails and dry them. Bath the arm with water and minimal soap using long firm stroke, moving in distal to proximal direction, then wash, rinse, and dry the entire arm. Next, washcloth in the basin, wring it out thoroughly, then fold the washcloth to form a mitt, and with the patient's arm raised and gently supported over his head, thoroughly wash, rinse, and dry the axilla. Follow the same procedure in washing, rinsing, and drying in the left arm. Cover the patient's chest with a bath towel and fold the blanket down the umbilicus, then washcloth in the basin, wring it out thoroughly, then fold the washcloth to form a mitt, and bath the chest using long firm strokes and do it twice. Drape one towel over the patient's chest and abdomen. Washcloth in the basin, wring it out thoroughly, then fold the washcloth to form a mitt. Keeping the abdomen covered, wash and rinse the abdomen under the towel, paying close attention to the umbilicus and surrounding skin folds. Do it twice and dry the area. And help the patient put on a clean gown, then proceed to the lower leg. Expose one leg by folding the blanket toward the midline while keeping the perineum covered, and arrange the towel lengthwise under the leg. Washcloth in the basin, wring it out thoroughly, then fold the washcloth to form a mitt. Next, wash the leg using long firm strokes from the ankle to the knee, and as you work, assess for redness, swelling, and pain. Then dry the leg. Next, washcloth in the basin, wring it out thoroughly, then fold the washcloth to form a mitt. Then wash the patient's foot carefully between toes, rinse and dry the foot thoroughly. Apply moisturizer if needed. Remove the towel, cover the patient with blanket, and move to the other side and do the same procedure. While the patient is supine, provide perineal care as needed. Next, help the patient into side-lying position and place a clean towel lengthwise along her side or back. Washcloth in the basin, wring it out thoroughly, then fold the washcloth to form a mitt. Keep the patient draped by sliding the bath blanket over her shoulders and thighs, working from the neck to the buttocks. Wash, rinse, and dry her back using long firm strokes, and do it twice. Next, washcloth in the basin, wring it out thoroughly, then fold the washcloth to form a mitt. Cleanse the buttocks and anus, moving from front to back and paying attention to the folds in that area. Rinse and dry the area, then do it twice. Remove the bath towel and drape the patient with a bath blanket. Help the patient in a supine position, then dress the patient with a clean gown. Set your patient in a position as shown in the video, with roll edges of plastic cloth with one end in pail for water to drain. Rinse hair with warm water. lather, and shampoo hair. Rinse shampoo away with warm water. Then rinse and dry the hair with a towel. Wash hands and apply gloves before beginning the procedure. Introduce yourself, identify the patient, and explain the procedure. Make sure that the head of the bed is at 90-degree angle. Put a clean towel across his chest and start by giving him a small sip of water to moisten his mouth. Apply toothpaste in the toothbrush. And brush his teeth by front to back motion to clean the outside, chewing, and inside surfaces of the teeth. Also make sure to use front to back motion to clean his tongue. After the teeth are clean, offer a cup of water and small basin so he can spit out the extra toothpaste and dry them out. Next, take a piece of dental floss that is 18 inches long, wind it down on the fingers and floss between two teeth, then move down the dental floss. Next, offer a cup of water to rinse his mouth and offer a mouthwash solution, then rinse approximately 30 seconds and spit and dry the mouth and apply lip balm.